The reason we did this work, the reason why we stepped into this arena was not because we were looking for something to do to honor my sister-in-law. No way. It was because we heard loud and clear from thousands of health workers for 3 years. For the first 3 years, every day I was hearing from people that I didn't know the day before who were identifying a state of affairs which is unacceptable for our healthcare workforce.
Welcome to Seriously Catherine, a self-confidence podcast for women who want to be taken seriously in the world of business. Here's your guest host, Dympna Weil.
Hello and welcome to the show. Today we are joined by Corey Feist, who is the CEO and co-founder of the Dr. Lorna Breen Heroes Foundation. Corey is a healthcare executive with over 20 years experience. He has a really unique perspective on the healthcare industry. He's authored numerous publications on the need to support the well-being of the healthcare workforce. He has served as an expert in multiple forums, including as a keynote speaker, a panelist, and a moderator, as well as provided formal testimony in the United States Congress. Corey's advocacy efforts resulted in the first federal law focused on improving healthcare well-being, the Dr. Lorna Breen Healthcare Provider Act, which we'll talk about later. This episode is something that's really near and dear to my heart. It's about healthcare well-being. Well-being in general is something I think we can all relate to. Taking care of ourselves, showing ourselves compassion, and burnout. And I think whether you are a physician, whether you're a nurse or a healthcare worker, whether you are a business owner or a mom, we all just went through a really difficult time with the pandemic. We are all facing challenges in the world. We can all stand to take really good care of ourselves, and we don't always do that, especially, I think, as women. This episode, I think, will appeal to a lot of you. You'll understand a lot of the themes really well and identify with that. We're going to talk about Dr. Lorna Breen, who was an extraordinary woman, an extraordinary physician, and an extraordinary person during an extraordinary time in New York City history during the peak of the COVID pandemic. It's going to be an episode that brings up topics that can be triggering to some people. So we are going to talk about mental health as well as suicide. I also want to bring up the National Suicide Prevention Hotline, 988, which you can call or text if you feel like you need support. There's also a special physician support line that's staffed 24/7 by volunteer psychiatrists. That, too, will be in the show notes and on my Insta. Thank you for being with me. There's going to be little nuggets in there for all the listeners. But first, a hot take brought to you by Paint and Sip. Imagine you are going to HR, to Human Resources, for a new job. And in order to get your ID, to get your paperwork processed, you need to fill out one more form. So this form asks you whether or not you have ever been diagnosed or treated for a mental health condition. Can you imagine such an invasion of your privacy? That questioning can be so vague that it could even encompass something that happened when you were a teenager or a kid, whether it was the loss of a family member and, you had an episode of grief and depression and needed treatment for that one episode. This is something that happens to physicians and nurses in many states in our country every single day. And it prevents these healthcare workers from seeking the mental health care support that they need. So tell me, what is the issue with taking care of a medical issue? What is the problem with seeking care? If you had a problem with your kidney, you would go get medical care for it. So why is the brain any different? This is one of the reasons that the Dr. Lorna Breen Heroes Foundation is so important, because they are advocating for the passage of legislation and the reauthorization of the Dr. Lorna Breen Act that was passed in 2022 to have this type of messaging and questioning removed from forms and different sorts of questionnaires that healthcare workers are asked to fill out every single day. The bill does need reauthorization this year to be funded. I'm asking all of you listeners to visit our show notes or visit my Insta page at Dympna Weil to find the links. They will take you to the Dr. Lorna Breen page where you can find the authorization page. It's very simple. Click on it, and it will connect you to your local Congress people and support that reauthorization. That's my hot take for today. Corey, first, thank you so much for being here with me on the podcast today. I want to thank you and Jennifer and the entire foundation for honoring Lorna and really demonstrating what's possible when you take action with love.
Thank you so much.
My heart still aches for your family, for Lorna's colleagues, for the people who never got to meet her. And so I wonder if you would be so kind as to just tell us a little bit about her.
I have described Lorna as, in some ways, as unique as her name and as typical as a physician or other healthcare professional. So, she was the crazy aunt to 8 nieces and nephews. She really prioritized her career over having a family herself. Her entire life, she always wanted to be a physician. She had an older brother and a father who were physicians and a mother who was a nurse. And so she really had that singular purpose in mind, which was to be an emergency medicine physician in New York City and own a black cat. Those were the things, and she had checked those. When I think about my sister-in-law, I think about somebody who was equally as passionate about taking care of her patients as she was her colleagues, as she was the students and the residents that she worked with, as well as, the entire care team. Lorna was the consummate overachiever. She went to Cornell undergrad. She got a master's at VCU down in Virginia, and then she got her MD from VCU in Virginia. And then she, of course, did the dual residency at Long Island Jewish Hospital in emergency medicine and internal medicine. Interestingly, because she was doing that because she recognized that there was a high degree of burnout in the profession, and so she was trying to create some flexibility. Later in her career, as she really matured in her career into leadership, she then was an overachiever and went back and got her MBA, or was in the process of getting her MBA. And she wouldn't just get it from kind of a fly-by-night online program, if you will. She went back to Cornell, and luckily for her, they had a program in New York. Lorna was a latecomer to the cello. Again, the overachiever. Let's pick one of the hardest instruments ever, having no background in that, and she began to play in a symphony, an adult symphony. They call it the Newcomer Symphony. She had a deep faith, so she was an active participant in her church. And I would say 2 other things about Lorna, and these in some ways go into the stereotypical emergency medicine doctor here, which is she loved to travel and take life, by the hair and just go and do crazy and fun things. And she would call us on like a Friday and say, yeah, I'm gonna go teach CPR in India. I'm like, well, that's great. When is the trip? And she's like, well, it's Monday. And we're like, wait a minute. Like, she just would go do that. Or when she would study for her boards, she'd be like, yeah, I think I'm going to study for my boards in Croatia. And she'd just go fly over to Croatia and go study for her boards. She also loved the snow, and she loved the mountains, and was an active participant in the New York City Snow Chasers and went out west a lot. And really planned her whole clinical schedule as an adult around these ski trips. And most notably for us, she always wanted to share that passion with my kids. And since I grew up in Miami, my skiing was not great. It was more water, not snow. And so she would take our kids on an annual spring break ski trip or go with us. And it was, she was really amazing, larger than life. And, we deeply miss her every day. I can't even possibly imagine. And so really my heart just goes out to you. When I think about that pain of loss, I just wonder, how do you go forward with that grief, right? And what you and Jennifer have done in the last
several years since is remarkable. And for those listeners, who aren't familiar, I'm speaking about the Dr. Lorna Breen Healthcare Provider Act of 2022, and it's landmark legislation providing funding that's needed to support our clinicians' mental health and well-being in a variety of ways. But how do you move forward with such a void and taking your grief and put pain to purpose?
Well, it's really, really, really hard. And in those early days, if you back up to the morning after my sister-in-law passed, I heard from a friend of hers who was a former reporter at the New York Times and said, "Corey, you don't know me. I was Lorna's friend, but what you need to know is that the New York Times has this story and they're going to publish her cause of death." I immediately tried to prevent that from happening because we were just in shock still. And the New York Times editor I spoke with said, "This meets our editorial standards and we are publishing despite your objection." And so the information was out within 12 to 15 hours of her passing. And, that provided us a window into something that really inspired the work, which was the response. It began the response by the healthcare workforce. And, my background, as you know, is as a healthcare leader. And I tried to spend really my entire professional career within a health system trying to make the operational environment for healthcare workers better. And what the response to her death was for us was this big eye-opener around stigma, mental health, etc. And so one of the things that I would just say about all of this is the reason we did this work, the reason why we stepped into this arena was not because we were looking for something to do to honor my sister-in-law. No way. It was because we heard loud and clear from thousands of health workers for 3 years. For the first 3 years, every day I was hearing from people that I didn't know the day before who were identifying a state of affairs which is unacceptable for our healthcare workforce. So the reason we do this is because we believe that we can make a difference to better the lives of healthcare professionals so they can simply do their job and do the best job they can taking care of patients. That's it. We believe that in many ways, this is exactly what Lorna was doing as a healthcare professional in her emergency medicine, in her emergency room. She was looking out for the healthcare professionals. She was the medical director, publishing about burnout. She was all about this space and trying to make the operational environment better. And so that's what's motivated us. And the response of we need more of it keeps us going. We would not still be here if we didn't have a huge amount of positive feedback about the work. It's really, really hard to do. For like at least the first 3.5 years since she passed, I told her story every day. And that was really hard. And, for me personally, but also, to kind of relive that trauma over and over and over again. But it's really been because we hear from that workforce and we hear from healthcare leaders that they want a new day. They want to create a new day. They just need assistance doing it. That's what inspires it and allows us to continue just one day at a time.
Honestly, that takes my breath away. When you were approached by the New York Times, number one, I can't imagine how that must have felt, because so often, particularly physicians, when they have died by suicide, a lot of times, anybody, right? People don't want to share that. And certainly you don't want to share that necessarily in the New York Times, right, with everybody. It's a personal thing. You want to be able to grieve. For you to take that and allow that to happen, first of all, and then to look at it as in such a, spin it in such a positive way to say, this is, it's profound. I remember reading it and it affected me because I can tell you, I have had my own mental health struggles, didn't seek help for the same exact reasons. I thank you for everything you're doing.
And thank you for sharing your story, because so many people just need to hear that that healthcare workers are humans and that they need the same love, support, mental health treatment, the ability to take a break, all the things that everybody else does. They're not superhuman. And Lorna was not superhuman, for sure, even though she felt like she had to be. And I think that's the issue, is that because the state of affairs systemically, in terms of how healthcare is delivered in this country, from just a process and operational perspective, it really relies on people being superhuman to make it work. I mean, think about the pandemic. We had healthcare workers across the country contracting the disease, dying, things like that, because they felt this obligation that they were here for a reason, which was to take care of patients, even if it put themselves at risk. And that's exactly what happened to my sister-in-law. So thank you for saying that.
Yeah, it was really quite a time. And it was, I can't imagine, hearing now directly, indirectly from people all over the country. You said that motivates you to continue on. Your background both in healthcare leadership, in law too, yes?
Yep. Yes.
That certainly helped, I would imagine.
Don't hold that against me. Yeah.
I would wonder if you could kind of take us through how you could so effectively get us from the point of nothing to Provider Act. And for people, I think, who are listening who don't understand how important this legislation is, we have such an odd system in medicine where we apply for privileges in hospitals, right? Hospitals have the right, they think, to ask us about whether or not we have ever in our lives ever needed mental health care. And they can hold that against us. Tell us a little bit about how you got us here.
Absolutely. And I think what I'll do is I'll talk a little bit about the passage of the Lorna Breen Act, and then then we should talk kind of separately about what you just talked about, which is these overly stigmatizing licensing questions, credentialing questions, because that's been its own kind of parallel success in some ways, and it's intersected with the Lorna Breen Act for sure. One of the things I would just go back to saying is you pointed out that the stigma around suicide is real. It absolutely was. We felt it. I've got my Stop the Stigma shirt on today. What we wanted to make sure of in that, once the New York Times published, is that we wanted to make sure of two things. One is that we did not want a sensationalized suicide so that was all people knew about my sister-in-law. So selfishly, we're like, hold on a minute. This is making news because of the way she died, but she contributed so much in her 49 years. We need to tell that story. The second thing that we wanted to do was we wanted to make sure that the world knew that healthcare workers were at risk taking care of COVID patients. So if I back up just a second, because this is going to get into the Lorna Breen Act and how we did this. After the New York Times published her cause of death over our objection, we became flooded with media requests. And it was kind of like, if you think back to the movie E.T., when there were these satellite dishes on their lawn and all this other stuff. It was like on my front lawn, there was just trucks and everybody had shown up and everybody wanted to talk to us. And we literally drew the shades and we just wanted to be sad. And in this moment of clarity, Jennifer, her little sister, who's my wife, separated by birth by about 22 months, Lorna and Jen were inextricably linked. I mean, I was the third wheel in that relationship. Jennifer and I decided that we needed to tell Lorna's story so that people could understand those two things. That this was a human, who was a great physician, and the second is that we needed to basically warn the country about what's going on with the healthcare workforce. Of all of the requests we got, we had connected with Savannah Guthrie at the Today Show, and within 48 hours of her passing, we recorded on my iPhone the first of what has now already been three appearances on the Today Show. Senator Kaine from Virginia, who is our U.S. Senator, saw the coverage nationally that came from the New York Times and the Today Show. And so once the Today Show happened, it just went all over the place. It wasn't, if it wasn't already, from the New York Times. And Senator Kaine reached out to us and he said something that was really important in retrospect. And for anybody who's listening, this is really important about your member of Congress, which is that members of Congress are assigned to different committees which have different subject matters. Well, Senator Kaine happened to be on the U.S. Senate committee, which oversees much of the healthcare programming in the country. It's called the Senate Health, Education, Labor, Pensions Committee, or HELP Committee. And I say that because a lot of people don't realize when they contact their member of Congress, if they don't have an issue where the member of Congress actually has a committee assignment that covers it. It's really hard for their member of Congress to really do a lot with it, frankly. But we were in this very unique position where Senator Kaine came to us and he said, hey, this is the committee I'm on. I can be helpful here. What are your ideas? Obviously he was incredibly just grounded, as he always is, and grief, and he just was so empathetic. And he also said something which was, my son is in the Marines, and I see huge parallels between the armed forces and their mental health and healthcare workers. And I remember him asking, well, I'm sure that there's at least as much support for healthcare workers and their mental health as there is for the military. And I was just like, nobody, no existing, right? So it's not there. So we worked with Senator Kaine over that first summer of 2020. I'd like to joke that I'm pretty sure he didn't know I was in healthcare when he asked me to send him a whole list of ideas, because that was a very, very long list. And it was basically, this is how you redesign the entire U.S. healthcare system 101. What that did was it moved us into a position now where we had something on paper, and they called back in the middle of that summer. They asked if they could name the law after Lorna. And I will tell you, it was an unbelievable phone call to get. We gave him his ideas. We didn't know that anything was going to come from it. But he just said, we want to name this the Dr. Lorna Breen Healthcare Provider Protection Act. And we cried and we said, of course. But in terms of how we were successful with that is the same approach that we have taken on all of our other programs to be successful. Because of my background in healthcare and because I understand how siloed healthcare is, we broke those silos immediately. We said we will do this on the condition that this be an interdisciplinary effort. We're looking out for all health workers, not just physicians, even though we have the word doctor in the name of our foundation. So this needs to be interdisciplinary. It also needs to be bipartisan, meaning both Democrats and Republicans, and bicameral, meaning we need parallel legislation in the House and in the Senate. It was that kind of philosophical approach, which, by the way, completely aligned with his approach, that really began the ball moving down the track. And what I would say to anybody who's interested in advocacy or just sharing their story, just the data is really important when you talk to members of Congress or their staff. But I will tell you, data doesn't move people. Stories move people to action. And so we had been also accumulating many, many, many stories over that year-ish. And so when we were asked to testify the first time in favor of the legislation, I was telling stories from many, many others other than just Lorna. And I will tell you, those are the things that resonate with members of Congress. The data supports the story to show that the story is not an anecdote, but those stories are so powerful. So the combination of an interdisciplinary approach, a bipartisan, bicameral approach, really attracted a ton of support across healthcare. And then we also had a kind of an unlikely partner in the work, which was the pharmaceutical company Johnson & Johnson. Their team heard the stories. They heard the stories. And in the Johnson & Johnson credo, they are very focused on helping support health workers. And they said, this work aligns with our credo. We have been dedicated to the nursing profession for over 50 years. We are going to donate our government relations team's time to help you get this done. That's what we did. And the Johnson & Johnson team was led by Kelly Waters, who's now their director of government relations in their DC office. And Kelly, as in that point, a junior government relations representative, she just made it her job because she was also moved. We got a call on March 21st, I think it was, from the Oval Office, and they said, would it be convenient if you come to the White House tomorrow to watch the president sign this legislation? And it was unbelievable. I said March 21st, that's wrong. It was March 18th because we signed it on the 19th. It was an amazing day, and it was truly, just a culmination of all of those stories that we'd heard and all of the data. The Lorna Breen Act, just for people who don't know what it has done, the Lorna Breen Act has done really a lot in a short period of time. It was signed into law within 2 years of its first introduction. And when you do that kind of a thing, what you need to know is usually legislation takes somewhere upwards of a decade to get passed the first time. And we did this in 2 years. So it had huge momentum. But the law in and of itself focused on creating programs that were overseen by HRSA, which is one of the agencies within Health and Human Services at the federal government level. It created 45 different grants for hospital systems and other healthcare organizations across the country to begin to implement their own solutions in their own organization to support the mental health and well-being of healthcare workers across the country. Those organizations were convened by a large national organization called IHI, which many people know as because of their focus on healthcare quality, along with George Washington University, and they put everybody together in what they called the Workplace Change Collaborative. So this Workplace Change Collaborative, 45 organizations, really worked over the past few years to really double down on learning from each other as well as implementing solutions within their organizations to support the mental health well-being of health workers. The second body of work that the Lorna Breen Act created was an education campaign focused on both healthcare leaders and healthcare workers about how to redesign this coal mine, if you will. That education awareness campaign, and people are like, why do we need an education campaign? Well, it was interesting because NIOSH, which is an arm of CDC, led this campaign, and we actually were able to work as technical consultants on the campaign. And they first went out to the workforce. They went to the workforce and they went to healthcare leaders, and they said, well, give us a state of your assessment of what's going on here. Well, I will tell you, what they heard from healthcare workers was, we don't need an education and awareness campaign to tell us why we are burnt out. What you need to do, and our recommendation is to give all of the resources to this campaign to focus on training materials for healthcare leaders.
Yeah.
And so we completely revised the campaign based on the feedback, and it became the Impact Wellbeing campaign and the Impact Wellbeing Leader Guide, which gives 6 phases of work for hospital leaders to engage with to begin the process of redesigning the coal mine. One of those areas is for them to remove these overly invasive questions about prior mental health from their credentialing questions.
So before we get into that, I think it's important for our listeners just to understand, leading up to this, the reason that so many healthcare workers, physicians would say, we already know these things, and we're going to say, hey, toss it to the administrators. It's because for so many years, really it was before COVID, the discussion about burnout, it was almost as if it was blame the victim, right? It was, you just need to be more resilient. Go to a yoga class, take a walk. And so it was a lot of administration in general would say, here's a relaxation room, but you don't get any time to go use it. If it was even addressed at all, that was a lot of the focus was put back on those that were already burnt out. Yeah, so it's interesting because that it's not a surprise that the response would be, yeah, we're already resilient. We wouldn't be here. They were some of the more resilient people in the world. You don't get through residency and medical school and all of the things without being resilient. I would argue we probably need to be less resilient and fall apart a little bit more. And then maybe it would be helpful. So that's my interjection before we get into the whole, I think that's probably part of it. We're too resilient, perhaps.
Well, it's a really important point because the concept about being resilient really shifts the burden of the workplace environment and fixing the workplace environment on those who are being subject to the environment and saying it's your fault. And if you were more resilient, you'd be fine. And what the data shows is that medical students, compared to their age-matched peers, are actually more resilient when they begin medical school. And actually, by the end of medical school, they're less, frankly, because of what we do to them in this process. And so I think it is not something that you can use yoga or meditation to get out of. The other thing is that it's also something that, when you think about solving problems, it's a very reactive approach or a Band-Aid approach to say, just go to therapy or just go to all these, go to yoga, because that never gets to the cause of the problem. And what I would say also is All of those things, yoga, meditation, therapy, peer support programs, they are critically important. But it's just that the response, and you're exactly right, the response by healthcare leaders to the workforce during the pandemic, when everyone was just in particular like, I don't know what to do here, was to flood them with those individual resiliency resources. And so, I'm like standing here as an unbalanced scale. And what we just need to now do across the healthcare industry is rebalance it. We need to say, okay, the individual support stuff is super important, but we have to look at why we need such support in the first place. And redesigning this coal mine is critically important, and it's very achievable. It is not asking healthcare leaders or the entire country to redesign the U.S. healthcare system like I thought I needed to tell Senator Kaine to do. No, that's not it at all. But there are very practical, tactical approaches and common sense approaches which will rebalance those scales. I want to come back to one other thing about the Lorna Breen Act, if I can quickly. Two things, actually. The first is I misquoted the date, which I don't even know why I didn't have that on top of my head. March 18, 2022. I said the 19th. It was March 18, 2022. And the reason why I wanted to flag that date is that in this past year, we worked with the U.S. Senate again to officially designate March 18th Health Workforce Wellbeing Day. And so we worked together with the National Academy of Medicine, the Office of the Surgeon General, and many other organizations to officially designate that day National Health Workforce Wellbeing Day, March 18th, because of the significance that this law wasn't just first of its kind in the US, by the way. It is first of its kind legislation in the entire world. That date, I want everybody to pay attention and circle it on their calendar, March 18th every year. Going forward, in particular, we're going to do an incredible amount of programming so that everybody knows we need to take care of healthcare workers.
I think people are surprised to learn that, about 300 to 400 physicians die by suicide every year. And that's, the equivalency of like 2 full classes of medical students a year that we lose of, physicians in this country. That is unacceptable.
The rate of suicide among physicians and nurses is unacceptable. And it is at least twice that of the general population. One of the things that we learned after my sister-in-law died was that there was already a designated day to recognize and raise awareness to prevent suicide in physicians called National Physician Suicide Awareness Day, September 17th. That date already and it was because pre-pandemic, what you just said is right. At least 400 doctors are dying every year by suicide in this country. It's unacceptable. I mentioned before that we've done a couple times on the Today Show. Well, the second time we were on was the 1-year anniversary of Lorna's passing. Savannah Guthrie asked Jennifer if she was concerned about a mental health crisis among health workers. And she said, absolutely. And the data would show that during a traumatic episode, people are just trying to get through it. But then when that traumatic episode subsides, there's a flood of all of the things that they had to push down. All of that trauma gets processed. And that's exactly what we're seeing now. The Centers for Disease Control has declared a mental health crisis among health workers. We are observing suicide rates among health workers at rates that I've never seen before. I don't have the percentage, but the number of phone calls we have received in the last year has spiked precipitously from what it was in the past. And so what people need to know is this is real. And if we don't do something about taking care of our healthcare workforce, there won't be a healthcare workforce to take care of us when we need it.
These are the people that care for us now. They are the people that are going to care for us in the future. And we have to do better by the ones that are here now. We have to do better by the ones that we're training. The numbers don't lie.
One of the things that I think is so important for people to recognize is there are a lot of levers that can be pulled right now that will prevent suicide and protect the healthcare workforce. And the one that we are really deeply focusing on is what I call institutionalized stigma around mental health. And it is institutionalized stigma, and that healthcare workers right now, if you are licensed, whether you're a pharmacist, a dentist, a veterinarian, a doctor, a nurse, you are being asked questions about your prior mental health diagnosis and treatment on a myriad of forms that you have to complete, whether those forms are for licensing or for employment or for payment for your services or for malpractice insurance or disability coverage. What those questions all have in common is that they violate the Americans with Disabilities Act in the way that they're being asked. Second of all, they also have in common that they reinforce that help seeking by healthcare workers is off the table. It is not something that you can even consider without retribution, whether that be your employer, whether that be your insurance company, whether that be your licensing board. This was Lorna's biggest concern before she died. Lorna had never had a mental health treatment in her life. She never had a mental health condition. She contracts COVID. She goes back to work too soon, and she gets run over by the Mack truck that is COVID and the operational environment. And we had to medically evacuate her out of New York City to get her immediate mental health treatment, her only mental health treatment of her entire life. And as she sat in that inpatient mental health unit at the University of Virginia Health System, 2 days in, she called home and she said, now that I've obtained mental health treatment, my career is over. I will lose my license. I will lose my hospital privileges, which are that hospital employment process to be able to work in a hospital system. I will lose everything. I will lose respect of my colleagues. As Jennifer and I are both attorneys, we're like, that can't even be a thing. I don't even know why you're concerned about this. We could not move her off that. She died articulating this to us as really the last thing that she told us about. So that issue now has been studied by the American Hospital Association together with the CDC, and they've published this suicide prevention guide identifying 3 key drivers of suicide of health workers. Well, they list this one, the very first one, the stigma and the occurrence of loss of license. The other thing that is true about all of these questions, wherever they appear, is that they are grounded in a prior way of thinking about mental health. They are grounded in this antiquated thinking that asking questions about mental health in the past is in some way indicative of someone's ability to perform a job safely, and that they would do some kind of harm to patients. That data does not exist. We do not ask them about their prior chronic disease, which is a much more higher occurrence in the general population, by the way. I think about 60% of Americans have some kind of chronic condition. The final thing that these things all have in common is that the solution is straightforward, and we have a free tool on our website at drlornabreen.org where people can go and make sure that they take a look at their questions, make the small changes they will have to make in these documents, and then importantly, tell the workforce what the rules are. Because that piece, the communication piece about this, needs to overcome years of programming, if you will, by the healthcare industry. What I'm very excited and optimistic about with all of that as a backdrop is that the uptick right now we are seeing in using our toolkit, and then we've now given out a badge, which is called the All-In Wellbeing First for Healthcare Champions Challenge Badge for licensing and credentialing. We're giving it out to organizations, and we're doing that not just so that they feel like they did the right thing organizationally, but so that they can use it as a communication tool to let their workforce know that where they are working is not going to ask them about their prior mental health diagnosis and treatment. The uptick in a very short period of time, while we were doing the Lorna Breen Act, just to give you a sense on licensing for doctors, when we first started to look at this about 2.5 years ago, there were about 17 states in the country that would have been awarded our badge. When I sit with you today, there are 28, about to be 29 states for medical licensing. That's hundreds of thousands of physicians in this country that don't have to worry about these questions being on their medical licensing applications. When it comes to them working in hospital, we have hundreds of hospitals across the country now. It began in Virginia, but then it scaled across the country that have gone through this work and continue to go through this work to make sure that on their local level, just like we have in the Impact Wellbeing campaign with NIOSH, at that local level, they are free from these overly stigmatizing questions. There's just snow rolling down the hill and building into this big snowball. We are now on what I would call an underailable track when it comes to changing these questions and getting these questions out of the system. So no health worker in this country has to worry about being asked about it. That only works if the healthcare workforce know what the rules are. We should want our healthcare workforce, whether they have diabetes that needs to be treated or depression that needs to be treated, to get treatment so that they can simply do their job.
And I just say, on behalf of myself and my colleagues, thank you. We think about if your heart needs care, you go to your cardiologist. We take care of our hearts, our lungs. Why is our brain any different? It is an organ just like any other organ in our body, right? Stop the stigma. And to your point, it's not just the stigma of these licensing questions, which is really, I've heard it myself in training, like, oh no, you can't do that. You can go down and talk to somebody in the office, but it's a real thing. But the other part of that is the colleague bit of it, is the stigma of what are your colleagues going to think? We, the healthcare workforce, have to start stepping up. And how do we do that? We have to talk about it. And that's part of the reason why I am so honored and thrilled you came to talk with me this morning, because we can't change unless we talk about it. I'm not very open, but that's why I'm talking about my own issues, right? I had PTSD. I had to take time off and wasn't sure I was ever going to be able to go back to work again. And this was several years ago. I was afraid to go back because what would my colleagues think? Like, I'm not able to take care of patients. And honestly, I didn't tell a lot of them. It's a real thing.
It's a real thing. And I appreciate you saying that that's something that you need to do, and you being in the healthcare profession as a clinician, because what we've said a lot is we can do a lot of these external things. We can clear the decks. I'm happy to lead this, and we are leading this, and we are partnering, but I can't change the culture. I can point it out. I can give you all advice, but until the culture changes from within the profession, and it begins in medical school and nursing school and pharmacy school, and it continues into practice, with the silent curriculum when they get out, we will never get out of our own way in healthcare, because we will be our own worst enemy. And healthcare professionals are too smart to get stuck in something like this. I was invited over to the World Health Organization to speak about the Lorna Breen Act. On that trip, I learned about how some organizations across the world are handling the stigma around mental health, because the stigma piece is really ubiquitous. I mean, it's everywhere. Most other countries don't seem to have these licensing and credentialing questions, but there's still a stigma around it. And so some of these organizations are taking the approach of looking at how doctors and nurses are documenting about their patients with mental health conditions in the electronic medical record, because you would know this, I would not. What I now understand is that the way that we even speak about our patients with mental health is not always favorable about them. And so that also reinforces this cultural stigma, right? If you're going to be sitting there writing in an official note about somebody who's got depression or a mental health condition in a pejorative way, you're never going to be willing to go put yourself at risk for being diagnosed with what that woman or man had. So it can begin with these simple things, which is, let's look at how we actually write about a patient with mental health condition in the electronic medical record. And interestingly, in at least 2 hospital systems around the world, almost at the country, that brought this up at our meeting, that in and of itself has begun to really transform the way that the clinicians are speaking to each other about mental health. So some of this stuff is really complicated, as you and I have discussed, like redesigning the entire U.S. healthcare system. Like, it's going to take us a couple years to do that, right? But some of this stuff, like speaking about it, like changing the way that we document about patients, we can begin this today. We don't need anybody's permission to do it. We don't need federal funding or state funding to do it. We just need to make a decision that starting today, we're going to act and behave differently. It's going to take all of us working together in an interdisciplinary way, prioritizing the workforce's well-being from within the workforce and outside the workforce, to really wrap our collective arms around healthcare workers so that they can just simply thrive.
Well, thank you for saying that. As an OBGYN, I worked for the first 6 months of the pandemic, and then I myself had a health issue that I have been out of work since. And so being a part of as an ambassador to the Lorna Breen Foundation, I have found that just being a part of this organization has given me hope that things are changing. I mean, the fact that you have the Lorna Breen Act, to hear you describe how it all came to be, I mean, it is remarkable. And I want to make sure that we mention funding is something that needs to be re-voted on frequently. This year, by the end of September, the Lorna Breen Act needs to be reauthorized and refunded by Congress.
Thank you for mentioning where we are with the Lorna Breen Act, because this was also something that we learned on the job, which is that when Congress makes a law, and when that law creates programs, which is what the Lorna Breen Act did, these group of programs for healthcare organizations as well as for healthcare leaders across the country, those programs are time limited. And so we have to extend them. Now, the first set of programs is expiring at the end of September 2024, and we have worked to have them extended for 5 years. What that means is if Congress fails to act, and we don't think they will, but if they were to fail to act, the programs would just sunset and the Lorna Breen Act would need to be revoted on to extend the programs. We don't think that's going to happen because the House and the Senate committees that oversee the reauthorization of the bill have all voted to pass the bill again. They still need to be voted on by both the full House and the full Senate. So that hasn't happened yet, but we are on the precipice of that happening. Even though this bill is going to be extended for 5 years, what we will have to do, as you said, is we will have to get it funded every single year. And we will have to go back to Congress. And by we, I don't just mean the Lorna Breen Foundation. To be clear, the Lorna Breen Foundation doesn't get any direct funding from this bill. We share a name, but we feel very obligated to speak on behalf of the law. But when I say we, I mean the entire healthcare community needs to go to Congress and say, fund this law every year for the next 5 years and beyond and beyond and beyond. Now more than ever, we need to have people reach out. So what they can do is they can go to our website. On the website, it's very easy to find about reauthorizing the law. In the Take Action section, the very first thing is reauthorize the law. It's drlornabreen.org/reauthorize-LBA. And they can send a message to Congress saying, please reauthorize and please fund the Lorna Breen Act. It's super easy. It takes 30 seconds, right?
We're going to have it in the show notes. I will have it on my Instagram page. It's going to be super easy for everybody to just click it. You put in your zip code. It'll bring you right to your Congress people. We
had a couple of our ambassadors came with me to Washington recently, where we met with some staff and some members to educate them on what's going on and tell their stories as ambassadors. And one, Jake Goodman, who's a rising fourth year psychiatry resident at the University of Miami, has 2 million social media followers and was able to generate thousands of messages to Congress in just a couple days. It's really important because they keep track of how many people are contacting them. Don't worry that you're spamming the members of Congress, if you will, because you can only send one per person. So it's not like you can just, they know these tools are built so that there's no spamming of members of Congress. It doesn't have to be just health workers who send messages to Congress. It can be any listener.
I would just ask everyone who's listening to help your local doc or nurse out. We need you. We're there for you, and we always will be. And just help us out. Corey, I cannot thank you enough. I have one final question for you. If you could share your best memory of Lorna, what would your best memory be?
It's interesting. My best memory of Lorna, I have two best memories to share, and one was a constant best memory. She wore the brightest red, like Taylor Swift level lipstick always. Awesome. And one of my favorite memories, though, was that she'd be in little old Charlottesville coming from Manhattan, and she'd be there for just a basic family dinner, and that woman would put that lipstick on, and she would leave that lipstick on my wine glasses. We'd have to get a chisel and a sledgehammer out just to get it off. That was always one of the things I'm like, really? But the other thing is because she worked in the emergency room, whenever she came to be with my kids, who really were like her children because she didn't have any, she would come and they would always ask for what we called Dr. Auntie stories. And it was just watching her tell these stories and watching her with my kids and them light up. It was just They were just always, she was the cool aunt, man. She was the one who was snowboarding. She was the one who drove the sports car. She was the one in the world traveling, but she always had those stories. So always hearing her stories. Her lipstick and her stories were my favorite.
Awesome. Yeah. Thank you for sharing that. Is there anything you'd like to leave our listeners with?
I just hope that, just gratitude, as you said, everybody in the country, whether you are a healthcare worker related to one, or you just use healthcare, we need to collectively wrap our arms around the healthcare workforce. Some of these things that we can do is just simply, when you go into the clinic next, is just thank your doctor or nurse and your care team. Ask them how they are really doing. It's the little things that go so far. And when you see the violence and threats against healthcare workers being something that is now commonplace in the industry, the general public owes it to healthcare workers to call a timeout, turn the volume down on the negativity, and we need to just wrap our arms around the health workers. So if anybody wants to get involved, if anyone wants to become an ambassador of our foundation, it's all on drlornabreen.org. Please become involved. Please help us spread this word and implement these programs to support healthcare workers across the country. And so just thank you so much for being an ambassador. Thank you for using this platform to help us get our message out. We are so honored that you are an ambassador of ours, and we have over 119 now, and that number is growing and growing. It's helping us scale our impact and get this word out. So thank you for having me. Thank you for all you're doing in this work, and I hope others will just take a moment to recognize a healthcare worker.
Oh, thank you so much for being here.
Got it.
Truly an honor. Today's serious business lesson is brought to you by the Palette community. This week's lesson is all about the willingness to be uncomfortable. What do I mean by that, and why is it so important? This month I've been growing in leaps and bounds in this arena, and because I'm asking for things from others, and that's generally not something that I am particularly comfortable doing. However, to bring meaningful conversations to you, my listeners, it was required of me to get really uncomfortable and ask these amazing guests and these amazing humans to join me in conversation here on the podcast. So part of the discomfort was knowing that no was always a possibility. However, so was yes. And I had to remember that yes was also part of the equation, because my brain just wanted to focus on no. Like, why bother? So I had to get really uncomfortable with that possibility and remember that yes was also possible as well. And had I not been willing to get uncomfortable, the answer would have been no 100% of the time, because I never would have asked in the first place. What are you willing to get uncomfortable for this week? What might that yes bring you? That's my serious business lesson for the week. And now it's time for our Saratoga Lifestyle segment. And this is brought to you by Saratoga Living After Hours. And if you don't already know, After Hours is the insider blog to Saratoga Living. Natalie Moore, who is their editor, she just wrote this awesome article about a legendary restaurant here in town. I'm going to divulge a secret. I have never been to Ciro's. Please do not judge. And now I just read Natalie's article, and I have to go. Like, she just kind of changed my mind about it, because she gave me the scoop on like what it's like inside and the menu that they're offering. She converted me. So I just have a few weeks. I have to get there. So you have to check it out. And if you're not already subscribed, you really need to. It's amazing. The articles in there are fantastic. My heartfelt gratitude to my guest today, Corey Feist from the Dr. Lorna Breen Heroes Foundation, for sharing his time, his insight, and his story with us. On a personal note, I want to say thank you on behalf of all the healthcare workers for advocating for our mental health and our wellness and care. We need our healthcare workers and our healers to be well, and we need to let go of the stigma around caring for our brains. That's not just for healthcare workers, that's for all of us. And to all of our listeners, thank you. Thank you for welcoming me to the podcast, and thank you for being here and for checking out the show notes notes or the Instagram links so that you can help reauthorize the Dr. Lorna Breen Act. So until next week, take care and be well.
Thank you for listening to this podcast. And if you want to connect with me, slide into my DMs on Instagram. My handle is Catherine Hover.